Appreciate that very much. It's an honor to be here today, both as part of this event and with this great panel. I look forward to moderating this today, and really turning things over to the panelists and hearing what they have to say. For our session, we're going to be building certainly on what the previous panel had spoken about. I think the conversation really moved right into where we're talking about with what Chief Best was talking about with what's happening in Seattle with the defund movement. But really, since I think we've all been in this space for a little bit, but ever since the murder of George Floyd and what folks saw with their own eyes on television, we've seen from coast to coast and from border to border a call for reform from all different ends of the community, and not only reform, but for more community-driven policing solutions to what we do. And that has come in all kinds of different forms of what people are looking for, all the way from abolition of police departments to more involvement from social workers embedded in police departments to defunding police departments. And there are many people that say defund, but I don't know that they have defund actually defined. So a lot of us are left trying to figure out what that means. Some of us have seen what that means, where we have councils actually saying, no, we're going to take budget away, and we're going to see what that means. But there's already a lot of those actions in place. I think there's certainly strategies moving forward that people are going to need to make sure they implement over time and figure out what that all means and how they do that, how they get other different responses to different issues. I also think there's no doubt that law enforcement, that the entire criminal legal system has been asked to deal with a lot of things that we probably weren't ultimately suited to be the ones that answered that. It's the reason why there have been so many different changes, things like law enforcement assisted diversion, which is what I'm involved in, the reason why we get case managers and folks involved with people that have mental health needs and substance use disorders, instead of sending them through the system again and again, actually getting them involved in things like harm reduction, recognizing that we're not going to be able to arrest our way out of the situation. And in fact, that punitive measures don't work. But how do we ultimately continue to drive that? And how do we get the community more engaged in it? And what does it mean when we ultimately say, okay, if the police aren't the right response to folks with mental illness, or police aren't the right response to the homeless issue that we have in so many of our cities and so many different states, basically in every state, what does that mean for that response? So what do we have happening now? What does that look like on some of the different initiatives that are occurring as we speak today? And where does that go in the future? And what does that mean? And how do we make sure that the community is involved in that? And how does the community help drive some of that response? And how do we do that, I think, really where we make sure that we orient ourselves to continuing to provide public safety, recognizing that we can't do things in a manner where we just throw something against the wall and see if it sticks and see if it works. We have responsibilities. We have to make sure that we keep people safe. We deal with ultimately many times the most vulnerable people in our country, and we need to make sure we protect them, protect those. But we also need to make sure that we hold ourselves accountable to what we do. So we need to make sure that we're doing that. So how is it that we lead that shift, and how do we make sure that we are that shift, that we're being responsible in what we're doing? What are some of those focus strategies? So we have a great panel today that's going to help us talk through that. And I'm going to ask them to each start off addressing one of the major issues, and then we're going to ask some other questions to get some things out. And I'm going to go down the line with each of the panelists and ask them to address this one thing. But certainly, when we had the murder of George Floyd and what we saw in all segments of the community coming out very loud and clearly stating that we needed reform, we also very loudly and clearly, and I think folks on this call recognize the racial disparities that we have within our systems and the inequalities. It's very hard to dispute that. And I think any of us, when we look at the data and we look at our experiences within the criminal legal system, it's hard to dispute that. So we have folks calling for reform, and many of us have been involved in reforming the system before and currently reforming the system. But I guess the question really is, for those that are calling for police abolition and defunding and true defunding, where they're saying take funding away from police and put it into other services, and when we do that, to actually do away with police officers, do away with police responding to certain calls, is that going to work? But really, can we reform our current system, or does it need to be dismantled? Does our entire system really need to be dismantled? And there are folks that are actually calling for that. And I think that we have to be responsible and actually not only listen to that, but answer that. Do we need to be dismantled, or can we reform? Because there are folks out there that are saying that we can't be reformed, that we do need to be dismantled. So if we're going to responsibly answer that, we have to have responsible solutions, and we have to figure out what it is we're supposed to do. And in the earlier panel, they talked about reimagining police, and we do have to reimagine what we do and what we do in a responsible manner. But we are answerable to the community. So how we do that. So first up, I'm going to ask Chief Ronald Davis, who of course we all know is the former Director of Office for Community Policing Services with the Department of Justice under President Obama. I'm going to ask him to kick us off today and give us some opening remarks around that and his experiences and his thoughts on that. So, Chief, if you don't mind kicking us off, I would appreciate it.
Thank you, Brendan, and let me thank the law leaders for holding this, law enforcement leaders for holding this seminar, this training. I think is very important. Let me just start with a couple of things. With the first question you asked is, can it be reformed? And I think after 30 years in local law enforcement trying to reform it, I will have to admit and say no, because reform over the past few years have been tinkering around the edges, a policy change here, a training change there, but it didn't go to, you mentioned racial disparities. I'm gonna go one more. This system is not only does it have the impact of racial disparities, but it's still very much impacted by structural racism. So we're gonna have to dismantle this thing all the way to the ground and rebuild it. The challenge is going to be that we got to do while we're flying the plane. We have to reconstruct the plane while it's flying, because you don't have the ability to just stop services and doing it. So when I hear the abolitionists or people say they want to abolish it, I think in talking to them, I won't take the privilege of speaking for them, but my understanding would be more to abolish the existing system because it has failed us. And when people are defunding, I think people are really talking about, like the earlier panel, reimagining public safety, with the idea that you invest the services and your funds to the services that are going to best impact public safety, not just crime, but public safety in general. And we know that we have over-relied on police for the last 30 or 40 years. We know cops are doing things that we know we shouldn't be doing, they don't want to do. And so to put services into mental health treatment, into reentry programs, things that will reduce recidivism, and to drug treatment, we know has a higher success rate than incarceration. That's why the organization was created, to reduce incarceration and crime. So I think the challenge moving forward is not to continue to debate about words that can be taken out of context, but to understand the community is at the point that is saying, quit tinkering around the edges, quit playing with policy changes, and do the radical and changes that are necessary to remove the structural racism. Most departments still operate like we did in the 30s, 40s, and 50s. We're using the same programs, we're fighting the crime the same way, and it's coming with disparate outcomes. And what I tell a lot of cops is, when you have structural racism, institutional deficiencies, that these systems are so bad that even good cops have bad outcomes, and bad cops get to hide in the system and operate with impunity. And then we start focusing on this bad apple argument, but it's not a bad apple. The whole barrel is rotten, and it's causing even the good apples, which are the vast majority of cops in this country. I believe that wholeheartedly, that the overwhelming majority of cops are good men and women trying to do a tough job. But if the system is flawed and we're sending them out there to do things they're not trained to do, to implement programs that we know we're going to have a disparity, then they're going to have those terrible outcomes. So we need to deconstruct it. And you said with the community involvement, I'm going to push back on that just a little bit. This is community policing means it's community led, not community involved. It's community led for the community to sit down and identify what's in its best interest with regards to public safety, define the role that the police will play in that new image of public safety, and then provide the appropriate resources. If that requires defunding, then so be it. I do hope as cities move forward, though, that the concept of defunding is more about the allocation or reallocation of services to where the most needed, and not a punitive measure like somehow you're going to punish the police by taking funding. Because if you don't do this in a strategic way, that even if you were to take $100 million from a police department's budget and give it to mental health services, it may take 2 years for that system to absorb those funds, provide services, and get the kind of return on the investment necessary to reduce the law enforcement footprint. So it has to be thought out. It has to be strategic. It doesn't mean that there won't be any more peace officers, but it may mean that we look completely different than we do today. And I think if we do it together, then I would want law enforcement to realize that we can't keep operating in this system, that we're going to have to make changes, that it's time for that change. We've been tinkering around way too long. As the Arnold Foundation project, what Yale talks about, it's time to start from square one and imagine what the future looks like for policing in our democracy and what role the community would like for the police to play. And I still think whatever role that is, that the police, as Sir Robert Peel said, are still going to be leading, at least have a significant role in that the police, that the public and the public is the police, and that they're one and the same, except for the police are those tapped by the community to focus on this full time. So we need to get back to some root community policing ideas of co-production of public safety. We need to not get defensive about the idea of defunding, but we don't need to be arbitrary and draconian in our defunding efforts because we want to be punitive. So we need strategy, we need thought, we need analysis, we need to think about what we're doing, we need it to be community-led, and we need law enforcement to be a part of the discussion to help guide the technical aspects of it. I think if we do that, 5 years from now, public safety will look different in most of the communities in this country, and the relationship between law enforcement and the community will be vastly different. So I'll stop there because other people need to weigh in as well. But thank you, Brendan. Appreciate it.
Thanks, Ron. I appreciate that. And I just want to touch on one thing that I know that we need to touch more on, and we need to have some serious discussions over, and we certainly won't solve it in a panel discussion. But, you talked about systemic racism, and I think that is one of the key things that we really need to bring out, and we really need to have a true conversation on, because sounds like you're as frustrated as I am when we hear the bad apples argument, and it just gets said over and over again, and we need to have that true conversation, because it's not about bad apples. If it was about bad apples, we would have already solved the situation and we'd be done with it. So we know we have to have a better conversation and actually solve that problem. So thank you, I appreciate that. So next up, I'm going to ask Commonwealth Attorney Stephanie Morales to talk about this situation from where she comes from, and Commonwealth Attorney Morales is the attorney in Portsmouth, Virginia, and she is the first female elected to that position in Virginia. And I'm going to describe you as a progressive attorney, which we need to have more progressive attorneys, who's really helped work with the community and worked with folks that are incarcerated to figure out what strategies need to happen when folks come out to really have a safer public, to really help them out, to make sure that, hey, what does it look like to make sure when folks leave the system to not continue to punish folks, to make sure folks come out and actually can get the services they need, get the help they need, and stand up on their own and not continue to punish them down the road like we've done so often throughout history. So Ms. Morales, if you don't mind touching on some stuff that we just talked about.
So first, thank you. And I do want to say the first woman in Portsmouth. There were many who came before me in Virginia. Don't want to take away from those amazing trailblazers. But thank you for sharing a little bit about my background and my philosophy on how I've operated as an elected prosecutor since 2015. One thing that I have to start off by saying is that I have to acknowledge that, before I am a prosecutor, I'm a Black woman and a mother of 4 Black children and a wife to a Black husband who has her own perspectives as an individual on the harms that the system perpetuates on communities, Black communities and communities of color. And I can't have this discussion without first acknowledging, who came before me in this conversation, and say that we are a system of systemic racism, period. And when we talk about systemic racism, we cannot remove the system actors from that equation. We have to acknowledge that the members of my profession, prosecutors, for years have perpetuated harms on Black communities and communities of color, poor and impoverished and LGBTQ+ communities. Police, members of the bench, judges, everybody who is a part of the system, the criminal legal system, is a part of that systemic racism. And we cannot just talk about the overarching effects of the system without talking about the people who are a part of the system and the system actors. And so, my profession has caused harm, and I try to take the restorative justice approach on a daily basis. to stay in the faces of those prosecutors in my office who are not just, making decisions that impact people's lives in matters like the one where we saw George Floyd lose his life, but every single day where there is a footprint of the criminal legal system on the lives of people in ways that many of us cannot imagine, where you feel surveilled, where you feel oppressed in school, where you feel surveilled and oppressed in your neighborhood, where you quite frankly don't have access to food, you don't have access to housing, and you are just at a disadvantage in life. And so when we have this conversation about defunding police, we have to realize and acknowledge that there isn't unlimited resources. And too many of these resources are being taken up by incarceration, by mass incarceration. Too many of the resources are being taken up, by punitive policing. And not enough of the resources are being taken up to provide mental health services, to provide, housing and food security, and to address the ills of society that are creating conditions by which members of my community, members of your community, are now engaging with this criminal legal system at a disproportionate rate. And we also have to have conversations about the way we determine who the system actors are going to be. Who are we entrusting with the role of becoming a public servant? When people are signing up for the police department, are police agencies having, lie detector tests where they're engaging in conversation about somebody's mental capacity? But then are we uncomfortable having a conversation about whether or not a potential officer is afraid of Black people or doesn't like Black people or is afraid or doesn't like members of the LGBTQ+ community? And if we are uncomfortable as officials having this conversation about how we select members who are going to serve our community, well, that's the reason why communities don't trust police and don't trust prosecutors. Because when we don't engage in that discussion and make these decisions to protect our community at the outset, we haven't earned their trust. And so I have very strong opinions about the harm that my profession and that the criminal legal system, the role that has been played and the harm that has been done. And I have to, say without any qualms that we must, we have to transform. There cannot be a reforming of something that is working exactly the way it was designed to work. We have to dismantle and rebuild in a way that is going to enable us to serve our communities the way we're supposed to serve. And if that means that, defunding police, that means that the entire criminal legal system will hopefully shrink. That means that I will lose resources in my office. That means I'm perfectly fine with that. And that's where if you are truly a person with a servant's heart and you want to get this right, we should not, this isn't something that I should be defensive about. We want to shrink this system. We do not want the footprint of this system on people's lives. This is not the way it should be. And so I will leave my comments at that because I'm sure all of us are passionate and could speak at great length about how we feel about this. But I want to just make sure that we are grounded in the reality that we have systemic racism and we institutionally have engaged in these inequitable practices for longer than any of us have been alive. And we have a responsibility now as the ones who have a seat of power to push for that transformative, non-incremental change at every turn.
Thank you very much. That was, first of all, that was really extremely powerful. And I appreciate everything you just said. I often tell people, listen, I'm a white Irish Catholic male. I didn't have any problems getting into policing. I walked into the door and I was automatically accepted. And at the end of the day, I needed to hear other voices, and other voices actually need to take precedent over mine, without a doubt, because the community I was harming as a police officer was not my community. At the end of the day, I do consider every community that I served my community, but ultimately the community I first walked into did not look at me as part of the community, nor did I accept that community as my community. It took me a long time to get there. And we all need to get that done actually much, much quicker, without a doubt. And then just to add on to what you were talking about in the end, we should come into the criminal legal profession with an outlook of putting ourselves out of work. If we're really about public safety, then we should be about having, people might think this is Pollyannish, but we should actually want no crime. We should want everybody safe. So if we actually want that, then we should recognize that the best way to do that would be to to get to a point where we can find solutions and put ourselves out of business, or at least shrink ourselves to the point where we don't need to be in masses out on the streets holding people back. So at the end of the day, we should be able to look at that and change our point of view to start thinking about how we shrink not just the police, but the entire system. And I think you really brought out a great point that folks are talking about defunding the police, but this is really more about a system change. This isn't just about the police. I always found, and I would tell my officers, stop getting so offended about hearing about police reform. Yes, you hear the word police. Yes, we're the ones on the front line, so everybody feels it's all about us, but folks are talking about the system, not just us. So thank you. So I'm now going to jump over to Dr. Marjorie Balfour to talk about some of the things that she's been doing and her point of view about whether or not we can reform or we need to dismantle. Dr. Balfour is working in Tucson, Arizona, and does some amazing work around working with police on behavioral health issues in the community, and really getting police the assistance they need to work with folks who are having mental health and behavioral health issues, and to keep them out of the criminal justice system. And then also to work with police on some of their own issues to be able to de-escalate and really self-care. Because ultimately, when we come into work as police officers, if we're on edge, we're going to go out and we're not going to do very well, or we're going to have trauma we're going to see and we're going to carry that over to our home life, or we're going to suffer our own issues. But at the end of the day, I don't think, mental illness gets spoken about a lot, but I still think we don't realize the resources we need to put into assisting people from a mental health well-being point of view. The work that I do, and we talk about substance use all the time, but sometimes we forget to talk about how many people are using substances to deal with an untreated mental health issue. And it's not until we deal with the mental health issue that we can actually get to the substance use issue. So, Doctor, if you would not mind.
Yes, so thanks for having me. And, it was said earlier that when we're talking, it's not community involved, it's community led. And, when you talk about defunding the police or alternatives, the first thing that often comes up is, well, let's send social workers instead of police for mental health issues. And we have a system now where I think there's definitely systemic racism, and there's also systemic prejudice towards people with mental health issues. If you call 911 for chest pain, you get an ambulance. If you call 911 for because you're suicidal or your loved one is suicidal, you get a law enforcement response. So from the get-go, you're setting up this situation to have a potentially bad outcome. And about a quarter of police-involved shootings involve some mental health issue. And then amongst those people, Black people are more likely to die in those interactions as well. And so we're setting it up from the beginning. And part of it's a prejudice, because would we stand for that with someone for our medical emergency response to be like that? No, we would never stand for that. But the mental health response is, well, there's not any federal funding for it really. It's up to the states or the local communities. And if after everything else there's enough money, we might fund some kind of mental health crisis system. And we don't tolerate that for anything other than mental health. And so there's been a lot of work on, there's a lot of good people out there that are trying to address this issue, because they don't want to lock people up for mental health issues, but that's what ends up happening. But the minute you start to train officers or train the police or even social workers or whoever's going to respond to these crises to do something other than bring them to jail, the first question is, well, then where do I bring them? And that's where you need the community response. People talk about crisis intervention training, which is a wonderful thing. And they talk about the 40-hour training that the law enforcement officers get to recognize signs of mental illness and de-escalate as like the only part of it. But if you actually go back and dig up all that stuff that the original model out in Memphis was talking about, it was a community response, because you need something to bring the person to get them the right care that's not jail. And so that's your crisis system. And so that's where the community needs to step up and start to address these issues for people with mental health crises. So, I mean, Arizona's been very blessed to have, over the last 20 years, developed a very robust crisis system where people can get help either through crisis phones, telephonic counseling. There are social work driven mobile crisis teams that can respond to mental health crises. Some of those are even diverted at the 911 level so that law enforcement's not involved. And then if someone does need a higher level of care, they can come to one of our crisis centers where it's 24/7 staffing with psychiatrists and nurses and peer supports and social workers who can safely take either the most agitated, danger to self, danger to others, psychotic people and get them the care that they need rather than to jail. But without that, you're always going to have a group that's too dangerous, too acute, too agitated for just the field worker to work with them alone. So, when you hear calls to defund the police and have social workers respond, I think it's been proven that works really great for a whole lot of people. And we have 16 mobile crisis teams in Pima County in Arizona that respond 24/7 to these. But there is an area that gets to be, in terms of safety, where it wouldn't be safe to have a response like that. You'd be hard pressed to find a social worker that wants to go into a house with someone who is agitated and psychotic and waving a knife around. That's not a crime, but it's not safe for a social worker to go respond to either. And so with whatever comes out of all of this reform and transformation, and it does need to be transformational, there will still be an area where the mental health system and whatever the public safety system is will have to collaborate. And fortunately, there are some really good examples of where that is working well. The goal, I think, is to get the right person to the right place with the right response that's safest for both the person in need and the people doing the work. So, there's models where social workers co-respond with officers. There's models where there's officers who do nothing but mental health work, and they're different than the police officers that are sort of in your mind or at least my mind as a layperson, as a prototypical police officer. So I think there's just a lot of room for collaboration, and it takes a systemic response from the healthcare system, and it takes a systemic response from the public safety world. And when we talk about defunding too, I don't think it's an either or, either fund police and public safety or fund mental health. There's a lot of work. Like I said, we have a great crisis system out here in Arizona. It's funded primarily through Medicaid, through the state. So there's no federal funding for it. Why? We see a lot of people, because everyone can end up in a mental health crisis. So, people who have private insurance end up in a mental health crisis. They come to our facility. We take, police will bring them in because they're suicidal or psychotic or whatever. We take care of them. Their private insurance doesn't pay for that. So then Medicaid picks up the tab. Why? So I think it's a larger, it's more than just either police or mental health. It's really the health system and the community need to get together to have a response for people. If we're saying jail is not the right thing, which it totally isn't, then we need the right thing for them.
Thanks, I appreciate that, and I think that I think you bring out a couple of really great points. I think first of all, that the whole point of it doesn't have to be an either or. This is about a whole system's change, and you don't have to stand on one side or the other, as we often see too often. And then just that idea of that balance of determining what the person might need, and realizing that determination usually gets done on a phone call. From a dispatcher at a 911 or a 311 system, where somebody's trying to figure out, is this somebody who's relatively calm, who, yes, we can just have a social worker go out, and that makes perfect sense to not have a police officer have to go. A social worker can go talk to this individual, figure out what's up, as compared to somebody who is, waving a knife around and recognizing that, we do have to make sure that the social worker would be safe, that the person is safe. And no, that person doesn't need to go to jail, but we need to have some safety measures put in place to ultimately get to the point where we can just have the social worker sit down and in a safe manner talk to that person. And it's really hard sometimes to articulate that, or at least to have folks recognize those different situations that might come up and trying to figure out the solutions of how you can have different responses to different cases and still back people out. Like there's no, like to have that way of being able to say like, hey, yeah, once things are safe, you could just have the police back out because the social workers are there in those cases. You know, there's definitely different solutions to different things. So, you know, I think those are things we have to continue to think about. So thank you, very helpful. So Sheriff Peter Koutoujian is from Middlesex County, Massachusetts. The sheriff has been with Middlesex for a long time now and has done some really amazing things there, and has brought MAT into the jail, has really done some work with veterans, has done a lot of work with youth. I saw recently, I was very happy to see this, you're the president of the Major Sheriffs Association, which I think is really important because that really helps bring some of that progressive mindset to sheriffs around the country and recognizing that, hey, just because you're the gatekeeper of where folks wind up going after they've been, either while they're waiting for a case to be disposed of or after they've been convicted and are being held in local jail, how we can ultimately get people help. So that way when they come out, they're not left with nothing else other than the time that they were just stopped from having anything happen, and recognize that when folks come into jail, they have substance use disorders, they have mental illness, they have needs like getting job readiness, they have support that they're going to need, and why bother wasting whatever time that is and creating more harm by not getting services? Let's work with folks while they're in, and let's figure out when they get out, like how do we continue to support? So Sheriff, you've done some amazing work. I have a feeling that the story earlier today, when it was told that a sheriff stood up and said, what we're doing is nuts, I have a feeling that might have been you that made that statement at the original meeting. So I will turn this over to you to give some opening statements on what we think around the whether or not we can reform or whether or not we have to dismantle our system.
Thank you very much, Chief. And it's a real pleasure to be here with law enforcement leaders again. You know, so just to give a point of context, I'm the sheriff of Middlesex County in Massachusetts. For contextual purposes, just understand my county and its makeup. Its population is 1.6 million people. It's 54 cities and towns, ranging from fairly substantial urban populations to many suburban, as well as rural populations. We house people sentenced up to 2.5 years, as decided by the courts. We also house all those pretrial, those being held either with bail or without bail until their trial or the close of their case. So we also have pretrial populations here. We have predominantly correctional responsibilities. We do have warrant apprehension for SWAT, things like that, but it's not predominantly patrol function. It's more predominantly corrections. It should be said that as the chief had said, I am the president of Major County Sheriffs of America. So 120 million people represented by these major county sheriffs, about just over 100 across the country, in some significant urban and diverse population areas across the country, from the far northwest to the northeast to the southwest to the southeast, all types being represented by our organization. And interestingly, also at this time of leading organizations like this, I'm also president of the Massachusetts Sheriff's Association. All these things have, this confluence of positions and the issues going on today have made for a very interesting time. So the Chinese blessing, may you live in interesting times. This has been achieved by me to this point. I am a founding member of Law Enforcement Leaders, and it should be noted for all those that might be watching, or it's just worth reiterating, it's to reduce crime and incarceration, right? It's not just to reduce crime, not just to reduce incarceration, it's to be able to do both, because you can do both. And I think Middlesex County is probably a pretty good example, not only because of the work that we've done here, but our local police departments, 54 cities and towns. When I started this job in 2011, we had about 1,400 in our custody, incarcerated individuals in our custody. You know, no one ever thought it would go less than 1,300, and then it hit 1,300. No one thought 12 or 11, or no, it would never break 1,000, never break 900, never break 800, and we broke 800 before COVID. And since COVID, the decarceration has continued to the point where today's count was 556. For a county of a population of 1.6 million, I think that's pretty remarkable. And again, I think we could take a certain amount of credit in the sheriff's office, but I think it's really good policing work around our county as well. I say this all the time. I'm proud of the programming that we provide in the Middlesex Sheriff's Office. I personally don't believe you'll find, you know, I don't want to say we're the best in the country, but I believe we're among the best in the country. But you shouldn't have to come to jail to get good treatment, right? You should be able to get that so you don't have to come to jail in the first place. Or if you do end up incarcerated, that if you get out, you have support services back out there so you don't have to return. And that's something that we don't focus on enough in law enforcement, is the resources necessary to keep people out. So we speak a lot here about bolstering community supports, successful reintegration. I think we've placed an enormous burden on law enforcement and asking them to play the role of social worker because society hasn't stepped into that role. I will say that our population is, you know, 80% self-report being drug or alcohol addicted. 50% of our population have a history of mental health, an open mental health case. And by the way, this should be of no surprise. Dr. Balfour will know this too. You know, this is just, you know, the three largest mental health treatment providers in the entire country are Rikers, Cook County Jail, and LA County Jails. This is just perverse when you think about where people are getting treatment. And sadly, we've become pretty good. We got pretty good at the treatment, but you shouldn't have to come to jail to get good treatment. 42% of our population that comes in has to be medically, go through a medically managed withdrawal or a detox, a medical detox. This is what we're seeing every day. And I can tell you personally that we have people in our jail that are there only, well, of course, many places, only because they're addicts, but also only because they have mental health issues. And they commit crimes because of their mental health, but they're otherwise not criminals. And they're only in here because they have mental health issues. And that's a real problem for me. So I believe that in correctional facilities, if it's done properly with the entire system, not just the jail or the place of incarceration itself, you have a unique window of opportunity that you can help turn people's lives around. Now, not everyone should have to come to jail for this, but for those that maybe, for some, it might be an opportunity for those. And that's what I seek. I see this as a window of opportunity. Also, you have to think about a population with unique needs. You know, not every person that's criminally justice involved is the same. So it's a unique, we have unique needs, we have unique treatments, and we have unique results. In a couple of programs that we've done, as a chief mentioned, we have a housing unit for military veterans. It's one of the first in a jail setting in the country. It has had remarkable results and has a really good feel when you're in there. It's been featured in a few publications because of our rates of recidivism and the results inside. We have as the chief mentioned, a medication-assisted treatment program. We've been doing MAT in our facility for 5 or 6 years now. And just last year, we started with the agonist therapy. So we're now actually doing methadone and Suboxone, or Suboxone inside our facility, where before we were doing the Vivitrol and Naltrexone, which, by the way, we have papers that we have issued on this that have shown significant results in lowering recidivism. So, but also in saving overdose deaths, which people have 120 times greater likelihood of overdosing and dying after release from a jail than they do just in the general population. So we've had really unique results. But the thing is, we always have to remember that it's medication-assisted treatment. We need the treatment. The medication isn't a substitute for treatment, right? It only assists the treatment. So a lot of people seem to think we can take our drugs and that will help us with our other drugs, when in fact, that's not the case. You need the treatment to help you overcome that addiction and get into that healthy recovery. That's really important. We also have a young adult offender program that is really remarkable. It was the first of its type in a jail in the country. It was modeled after we did it with the Vera Institute. And that has had really remarkable results of same gang, cross gangs, young men that were involved in every conflict and problem inside the entire facility, now living in one unit with special accommodations and special programming, and actually working really well. So we have like almost no problems from these individuals, where when they were spread out throughout the whole idea of corrections is you classify people away from each other so they don't cause troubles when they get together. Here we put them all in one, and I think my operational staff thought I was crazy when I first started doing this, and yet it's worked out fantastically well. But the thing that I worry most about these programs is so much of the success of these programs was the aftercare, the community care, the support services in that community, because you can do a lot inside, but once you get back out, you need those supports. And that's really what we're having a greater struggle with regard to COVID. I'll just mention two other things that tie into something that Dr. Balfour does. One, we have been, through Arnold Ventures, we have been a pilot site for the Data-Driven Justice Initiative, which is to help identify the familiar faces, as we'd say, the ones that we see in our police departments, in our emergency departments, and in our houses of corrections, and to identify them and to be able to get them the help that they need. Because between our disparate silos, they're just falling through the cracks, you know. One silo will know them really well, but the other two won't. Or they'll have enough problems in each silo, but no, they don't rise to the level where anyone even notices that they're having these problems. And they cost a lot and they suffer a lot and nothing seems to work. So if we can focus on these individuals by identifying them and getting them supports, that can be of help. And then our Middlesex County Restoration Center Commission, which we took a visit down to see Dr. Balfour's Tucson model with Chief Magnus, which is an incredible model. And the whole basis of that is, especially with those with mental health crisis and substance use disorder, that it's a place to bring them. So instead of where police really respond to a situation, the only tool that they really have to diffuse that situation is arrest. And it's just been the way it's been done. And I think people see now more and more that you don't have to do that. And the Restoration Center allows police or others to, instead of bringing someone either to the emergency department or to jail or to their lockup, they can bring them to the Restoration Center. And this is important because this is not either, some call it diversion, some call it deflection. It's not just a diversion or deflection away from the criminal justice system. It's a diversion or deflection to the services that they need in the first place, right? So we have to stop saying it's diversion away from criminal justice system. It's actually to the services that they need. That's really important. If we're going to deflect, let's get them to where they need to be, not just where they don't need to be. I'm just going to kind of close out with that and just say that, you know, we've been fortunate when I say that why is this population, this decarceration occurred in Middlesex County? Well, we've got a lot of progressive police departments, probably like, you know, Chief Magnus, where they're using co-responder models and diffusing situations that don't need to suffer arrest and actually improving the relations in the community at the same time. So that household that you used to go to, which was always a hostile situation, is now a place you can go to, help an individual, help a family, and it's a much more positive situation. We've moved from the warrior model to the guardian model, and we're kind of moving toward that social worker model. And so this is kind of the direction I think that law enforcement has been moving and will continue to move. I'll say in closing, correctional facilities are not fortresses on a hill, right? Everyone thinks they're just this isolated fortress, and you just sit there on a hill, and and the community stays away from you, and you stay away from the community. Correctional facilities are part of a community. They're not fortresses on a hill. And if they don't behave as part of a community and engage with that community in the same way, so that people don't have to come to them, or when they get out, they can be supported, then we're going to miss this boat, and we will become those fortresses on a hill. And as we've learned, we can't arrest or incarcerate our way out of these problems.
Thanks, Sheriff. Appreciate that very much. And I think, you know, a couple of things to highlight there. I mean, first and foremost, what you really ended on is that this has got to be a collaborative effort. You've got to have partnerships. You've got to have, you can't just do it alone. So to have all of the police agencies in your jurisdictions join you and be partners and do things on the outside as well as the inside, that really helps. Recognizing that you need more. You know, one of the things, and I make the mistake even in my line of continuing to say, you know, divert away from the system. What we actually try to say is, you know, divert to more. Like we should be doing more, not less. That's the key. Like try to engage people more If we recognize that there's a substance use issue, if we recognize there's a mental illness and they're getting caught up in this punitive system that we have, we should be doing more to keep them out and more to engage. And that will actually be what helps. You talk about the overall numbers inside the jail of who has a mental illness, who has a substance use disorder, who has co-occurring disorders. And one of the things that I do when we talk about LEAD and we do officer training is I ask for like informal polling and say like, hey, I'm not asking you guys for a legal definition or a diagnosis, but how many people a day that you guys were dealing with? If you had to go the last 10 people that you dealt with, how many of those folks had either a substance use disorder or a mental health issue? And, the numbers are just astounding. The officers are like, like 9 out of the last 10 people I dealt with had some kind of issue. And unfortunately, not all sheriffs and not all jails have services. So when then I ask, okay, well, if you make an arrest and if they go into jail, are they getting any kind of assistance? And overwhelmingly, the answer is no, they're not getting any assistance. And of course, then there is the case of even if they are getting assistance, what's happening when they come out? And it's like, well, no, they walk outside the jail and they're not getting anything further. So how do we collaborate? How do we make sure we do that? Which kind of brings into the second question. So I'm gonna ask you each to just comment briefly on this, and then we'll do some individual questions. But I think one of the things that's at least been on my mind since for a while now, but especially since hearing Chief Best talk, is this defund thing. So we know that like Seattle, their council, their legislative body is calling for a 50% reduction in their budget, taking that completely away. And we all know that our police budgets are mainly personnel. We know in Minneapolis, there's this call to do away with the entire police department and recommission a police department and build it from the start. So based on all of your professional opinions, if you guys could each spend a minute, just what would your recommendations be if like this was your decision, or if you were in that chair and this was going to come before you, what would the recommendations be to the community, to the stakeholders on what steps to take, or what would be the key ingredient to do this? And Ron, if you don't mind, I'm going to pop back up to you if you don't mind kind of giving your comments from your perspective, especially all the experience you have. I mean, to me, like the 21st century policing, that was talk about a document that could lead people down the right road of change and a way to work together to have a public safety, to provide public safety together. That was a roadmap, and it's still a roadmap. Just because we have somebody in office that doesn't want to admit that at this point doesn't mean that's not still a roadmap. But from your perspective, like the defund, the change police, like what would your recommendation be to that community to make sure they're looking at like what should they be doing?
So just a couple of things real quick. One, I think they would have to collaborate. What I mean by that, the community needs to bring in all the stakeholders. A good example, one of the doctors mentioned, maybe a social worker doesn't want to go to a call with a knife, so don't presume to make that decision for him or her. That it should be strategic, that you make decisions and you have a strategic plan on how to achieve that defunding in a manner that does not compromise public safety. And what I mean by that is if we do this wrong and leave gaps and crime or violence goes up, not only will we not defund the way we should or reallocate, we'll actually start refunding it at higher rates because fear will drive. People will make a false narrative and a false link between crime and less police. And we know that's not a link that there's any evidence to suggest it. So collaborate, be very strategic, and quite frankly, make sure your investments are evidence-based. Just don't throw a whole bunch of money or a whole bunch of places unless you're going to go to those community-based and social programs that you know are going to work. There's people at the grassroots level every day out there struggling, providing great services. So find a way to fund them so that they can reduce your recidivism rate. They can provide services to those in mental health crisis or prevent the crisis to begin with. They can deal with kids that are not kids that are at risk or people that are on substance abuse. So I think if you don't do those things, then all you're doing is just cutting a budget. If you cut the budget and you do so arbitrarily, there's some unintended consequences. One, if you just arbitrarily cut in one swipe, then 85% of that budget is personnel, which means as a chief, I'm going to lay people off. And maybe I need to reduce the size of the budget, but as a chief, I don't want to do it through a layoff process because bottom line is last one in is first one out, which means you just got rid of my diversity, my youth, my analytical millennials, and I'm stuck with, not stuck, but I have the rest of the department who may be much more resistance to change is what I have left. You want to do it strategically so that through attrition, through reductions, to evaluating what services you can and cannot do, things you can stop doing today, that you can start transitioning those services over and start building it. You reduce law enforcement footprint and you increase social services. But if it's not strategic, if it's not collaborative, and if it's not evidence-based, then I am really concerned it will have a unintended harm to the community, which will undermine the entire effort.
Thanks, Chief. I appreciate that very much so. C.A. Morales, so what are your thoughts, especially from that prosecutor's lens? What would be your recommendations or the things you'd want to make sure that folks were paying attention to in this moment?
Right. So I always, have to ground myself before I speak to anything. And again, just in grounding myself and setting the tone for my remarks, we have to, again, think about community. We have to lead always from a place of thinking about community. And we have to acknowledge that the government has divested from the Black community, or maybe never invested in the Black community and in other communities that have been impacted tremendously by this criminal legal system. And so when we start talking about defunding police, people get upset because there's always this desire to be comfortable and to be friendly with each other. And that doesn't sound like a very friendly thing to say, but the reality is that sentiment of wanting to defund the police is really about reinvesting in community and about investing in community. And again, I hearken back to what I said earlier. We don't have unlimited resources. And so when we have limited resources, we have to think about what we're not funding when we're overfunding potentially police departments. If I'm seeing in a community, in a public housing community, law enforcement officers that are patrolling in that community, and I have young people who feel like they're in a police state, but in that very same community, if school is not in, they're not eating, and we have food insecurity, and we have a wait list that's extremely long for public housing. We're not even talking about traditional neighborhoods. We're talking about public housing, and there is no access to that. We have issues. We have issues when we don't have adequate funding for housing, for food, when we don't have adequate funding for education. In my community, there's a constant struggle between city council and school board about teacher raises, about fully funding education, about providing new facilities to account for, more children matriculating through the school system. And so why are we having such a hard time having a conversation about reallocation of funds and divesting from one way to reinvesting in another way that's going to hopefully keep people out of this criminal legal system and decrease its footprint in the first place? So I welcome people to get comfortable with being uncomfortable and to lean into, the move away from the desire to constantly be friends, but let's operate out of a place of respect for each other. And we have these conversations that we have not had for too long. And we move away from, all right, well, let's make sense out of it and let's figure this out to perfection. Well, the reality is what we're experiencing now is harmful. It's imperfect, and it's operating as it is designed to operate. So we may not have a perfect solution, but we know that what's happening now, it's harmful. It's not working. It's very disruptive in the lives of people on a daily basis. And so I am an advocate for the defunding, but we have to acknowledge what it is about. It is not about taking away something from individuals. It's about reinvesting and investing in community to really create that opportunity again, not just for people to live, and have their lives, but for communities to actually begin to thrive and function as a society that that is what is the American dream and what it is supposed to be and what some experience and what others do not.
Thanks. And I think that's really important. I think, I think unfortunately sometimes how we speak and what we say gets framed in a way that takes away from what we're trying to do. And I think that the word defund has taken us down a road. I walked out in the middle of a protest, counter protest the other day, happening on my street. That was it was ridiculous. It was clear that people just were not listening to what the message was. So yeah, that's extremely important. So thank you. Dr. Balfour, your thoughts on what your recommendation would be to folks that we're having this conversation right now.
Yeah, and like everybody else, I'm still trying to figure it out for myself. Those first two remarks were very helpful, actually, just listening and helping me. And I think when it comes down, I'm a data nerd. I used to be a researcher. I think when it comes down to it, we should, as a community, which includes the police and which includes, everyone, be thinking about what are the outcomes we want as a community. What does a safe and healthy community look like? And then what is the smartest way to achieve it with the resources that we have, which, I live in a red state, so always have a mind towards responsible stewardship of taxpayer funds too. And not only is it harmful, but it's wasteful what we do. So how do we achieve, first of all, how do we agree on the overarching outcomes? And then how do we achieve those smarter in a way that gets the outcomes we want, and and it's responsible and using resources wisely? And then kind of I agree with what was just said around, we have to maybe be comfortable with being uncomfortable and kind of get over our silos of this is how we've always done it. But and then to what the chief said earlier about being evidence-based, there's things that we know are evidence-based and we don't do, like putting somebody with a substance use issue, just give them a place to stay, and they immediately their utilization goes down, their interactions with law enforcement goes down, their over time their interface with the healthcare system in a healthy way improves. And we kind of get around, well, we can't do that because people need to earn it and this and that, and instead we just keep arresting that person over and over again. That's stupid, and we should stop doing that. Things around mental health, just getting people the services that they need will keep them from being hitting up against law enforcement all the time. Investing in communities, like we talk about in my world, we talk about the social determinants of health a lot. So there's whatever underlying genetic disease issue you may have, but that is equally, if not more, the outcome is affected by your basic needs, your housing, your living environment, your access to healthy food, things like that. So investing in those things is going to make the community healthier. And then just be agnostic as to how do you achieve it. Like I was saying, there's some situations where you want somebody who has a public safety training and background, and there's other situations where it is more of a social services response. And the money ultimately all comes from the same place, so who cares who does it? That's kind of that's easier said than done, but I think just starting off on where can we agree we want these outcomes to be better, and working together towards it, I think would be my advice.
No, thanks. And I think, you guys have all said this, coming out of silos means a lot, like to get out of your silo, to recognize there's other partners that can do their job very well, that it's more than just your system that needs to be changed. And yeah, I can't agree more. I mean, it's okay to be uncomfortable, and it's okay to recognize that, like, you don't know everything. And sometimes being uncomfortable actually makes things better. One of the things that I talk to a lot of police officers about is losing empathy. And I think that we let losing empathy get in the way of making smart decisions, and losing that evidence-based piece of recognizing, like, well, if we know that housing will actually reduce substance use, or housing will reduce police contacts, then why don't we house people? That sounds like the smart thing, and worry about the substance use issue later on. Like, if somebody's living on the street, we're never going to address the substance use issue if that's where they're going to stay. Like, I know what I would be doing if I had to live on the street. So I mean, let's talk reality. But if we don't have empathy, if we don't have if we don't have the true understanding, or want to have that understanding, that can make it very difficult. So really good points. Sheriff, if you don't mind, weigh in a little bit on
Yeah.
what your advice would be.
Thank you, Ron. So I just want to say I was a funder before defunders became popular. And what do I mean by that? Now we hear a lot about defunding police. Some of the other taglines is refunding social services. But I think it was C.A. Morales, I think it was you that might have mentioned the fact that we haven't funded them for years. So we got to fund them, not refund them, right? And And for ever since I've been sheriff, I've been speaking about the fact is society is they don't like law enforcement generally, right? It's just not a great time to be in law enforcement or corrections. It's a job that no one wants to think that society has to do. But society hasn't been dealing with the underlying issues that bring us to the point where people become justice involved. And I speak about that issue of, there's a lot more now on the race lines. So that's a whole different issue. And I think that's really important we speak about. But among the other determinants, a lot of these things society has just neglected to fund. When they released large swaths of individuals from institutions for the mental health treatment, they said the money will follow them into the community and they'll get all their treatment in there. It'll be better and more humane, we'll have better outcomes. That didn't really happen. The fact is, people with significant mental health issues ended up in our emergency rooms, in our police departments, in our correctional facilities, because we're not treating them. We're not treating the source of addiction right now. So I think that we need to fund these programs. And I've been saying this for a long time. It's easy to be pointing fingers at everyone else, but you also have to do what you need to do. And that's make a decision as a community, as a society. We will fund resources that are important and that will help our communities and allow people to stay away from the justice system. I think that Dr. Balfour's comment about, we can defund, and there's a lot of talk about social workers instead of police officers, but the fact is, most of these situations, as much as you want to send a social worker in with a police officer, you generally don't want to send a social worker in without a police officer in many of these situations, because they're very impassioned, they're very emotional. They're many times involving mental health issues and domestic situations, and they can be very dangerous. So you really have to have that pairing. I think Chief Davis mentioned something like that. I think we need to speak about the social determinants, right, of where we need to fund. I mean, housing has been mentioned. I wrote down a couple here. Employment, education, food, trauma. I mean, I got a ton of people up here in my young adult offender unit. I thought it was going to be a lot more, substance use disorder. It wasn't. It was a lot of mental health issues driven by trauma. They'd had traumatic youths, and they never had people in their lives as family members that could help them develop through those. Firstly, is why the traumas probably happened, but secondly, no one to help guide them through the traumas and beyond the traumas, right? And so trauma is a big thing we're not paying attention to here as well. I will say that our programs that we've had real success with are because the relationship with the community and because there's a natural infrastructure to turn them over to. Our Humvee unit, housing unit for military veterans. Well, there's all sorts of benefits available to veterans that many times they didn't know was available to them, or sometimes they were discharged in a way that either they didn't believe would give them services or wouldn't give them services. And through our work, we can either connect with them or actually have their discharge lifted up to a point where they can get those services. And so that has had incredible results, as has our medication-assisted treatment, because once we got the program up and running in the community, the problem at the beginning was in the community. The first program failed because no one would service these men that we have men in our facility in the communities, even though it was only Vivitrol. It wasn't even Suboxone or methadone. They all thought it was all methadone, and no one wanted to treat these guys. And so now we have well over 100 vendors across the state that support these people. That's why it's been successful. And then lastly, I'll say this, Chief mentioned it, data, and Chief Cox, you mentioned it too. Data. Data shouldn't assume everything, but it should be really paid attention to. I speak a lot nationally about this. We are data nerds, like you said, Dr. Balfour. We are geeks in here. I love getting more data. I love extrapolating it. I like checking it out. I like seeing if there's a relation. I like finding new data points. And this is what I always say. Data or vision without data is just a hallucination because you're flying blind. And this is the thing that frustrates me is if we are going to fund many of these other organizations and services as we should, then we also have to find a way to track the data, because we all know that we poured hundreds and hundreds of millions of dollars into a program that was the favored child of law enforcement communities. The DARE program, right? It was the answer to everything. We're going to build out, we're going to reduce recidivism, we're going to build a relationship. Now, I'm not saying that DARE didn't have benefits, because of course a relationship with police is an important thing, but it didn't have the benefits we all assumed it was having. And by the time we studied it and had spent hundreds of millions, perhaps billions of dollars, in communities across this country, it was too late to go back and say, maybe we should find a different, better program to do this. So number one, we threw money at a program that didn't work. And then secondly, we didn't develop a program that might actually have worked earlier on in the cycle and then funded that properly too. So data has got to be part of it. So if we're going to fund these things, then we have to make sure we're finding a way that we can check the metrics of the results. And that's for good or for bad. If it's for good, if it's good stuff, then we should be doing more of it. And if it's for bad, that doesn't mean we don't fund resources in communities. We just find a different way to do it, or different resources or better ways to do it. That's all. It's correcting that action, not then defunding those same services, but correcting the direction of where we want to go.
Go ahead, Ron.
Yeah, I just wanted to add one thing based on what everybody's saying. I think we can never forget, for the community that's moving forward or the leaders that are pushing forward, that this is still a political process, that the decision-making process of funding and government funds is convincing the elected officials to do so. And I think the more we realize, in order to help elected officials not respond to the emotion of the moment, which is it highlights a lot of issues, not to respond to the tragedy that has highlighted the need for it, that should be a driving motivation, but to respond to the idea that what you're engaging in is what's in the best interest of that community, short-term and long-term. And so we got to have the kind of strategic thought and plan. And I agree with C.A. Morales that makes us uncomfortable, but we have to be careful not to make sure operators need to be very uncomfortable. As a police chief, you need to make me almost nervous because you're taking me way outside my comfort zone, which is you're supposed to do. But we don't want to take the community to where we can create false narratives that creates the kind of fear that stops the political movement. And for the young people that are driving this agenda, it's great that you're on the street, but now you got to go to the council meetings, you got to write to elected officials, and you got to make it clear that this is what you want, and just make sure. And the last thing I would say is, what I saw over the years as a chief is, I want it to be evidence-based, but a lot of our grassroots organizations don't have the capacity, even if we start refunding, and not refunding, but reallocating, it's going to be hard for them to compete to get the dollars because they may not have that organizational structure. So we're going to have to make some investment in the community, that there's people that don't have the fancy grant writers, stuff like that, but they've been on the street doing this job every day. They'll be more effective than any formal program to make sure that as we reallocate, we're not creating a new industry of nonprofits that are going to pop up and undermine those that have been working deep in the community for years, that we build capacity, that we drive it, we make sure those closest to the problem get the kind of funding, and we know it's evidence-based, and then collect, I agree with the sheriff, collect the data, so we can make sure that the elected officials that vote for such a movement are backed by evidence, by data, and by the community.
And Chief Cox, if I can just add to that, Chief, I couldn't agree more, excuse me. And I think you're right, because I see many smaller groups out there that don't have the sophistication to gather the data, to think of the data, or to present the data for grant applications. And I find that frustrating. I believe that there's got to be a way, and I've been kind of speaking to a lot of the grant, COPS office and others, there's got to be almost a way to template data points and data production that can be given by the government, right? Create a template system that's fairly easy to use in some ways, and then give it somehow so that it doesn't fall on those organizations to do it. And then you can have uniformity across a whole bunch of data points from a whole bunch of collection points at the same time. I think you're right. A lot of these smaller shops won't be able to do that, but they'll be doing good work. We just have to be able to allow them to show that that their work is efficacious. Really good point.
There is definitely a lot of frustration, I think, at a local level of working with community groups that don't have the capacity to collect that data. But then I've seen this from my level of trying to work, especially with government agencies, to recognize what data needs to be collected, as opposed to collecting the wrong data, or data that's for one program that doesn't follow over into another program. Like, you can't, like for LEAD, we're not as concerned with how many people are going directly to treatment because we're a harm reduction based initiative. So if all that program is doing is collecting data on who goes to treatment, well, yeah, we're going to have some people that go to treatment, but you're not going to do justice to a lot of our initiatives that aren't getting people directly to treatment, because quite frankly, the people we're working with aren't ready to go to treatment. That's going to come further down the line. So there's a lot to be said there. You guys started to touch on something, so I'm going to put something out there and just let you guys pipe in how you all like. So one of the things that I think is frustrating for some folks is it's kind of twofold. So we just talked a little bit about the defunding, people now trying to push legislation to do that and what advice we would give. One of the things that I certainly saw in my time as chief, and I'm assuming that you guys have seen at different times, are legislators that try to either pass legislation that's actually harmful, that put us in a bad position, or refuse to repeal legislation that's harmful, but just expect us to fix it on the front lines and to make adjustments. So what can we do in this time of this call for reform, this call to change how we do work? What do we do to get our legislative bodies to change, to not react, to not make a sit-lie law that you can't lie down on a sidewalk and all of a sudden put the police in a bad position again, or they're writing somebody a ticket or sending them to jail on things that we shouldn't be doing? How do we address our legislative bodies?
However we can. I think this is one of these times where we really have to be committed to fighting in any and every way that we can. That means, through collaboration, if possible. Like, in Virginia, a group of 12 of us formed an organization called Virginia Progressive Prosecutors for Justice, simply by committing to advocate for the laws in this special legislative session that we thought would protect the members of our community, in the areas of police misconduct, in areas involving mandatory minimum sentences, a variety of different things that we're unified around. There are 12 of us where there are over 100 elected Commonwealth attorneys in the state, but the 12 of us represent 42% of the population of the Commonwealth of Virginia. And so, we felt for us, look, we need to collaborate. We're in the trenches, we know each other, we communicate with each other because we always do this work. But now is the time to elevate our voices. And yes, we are, in unifying, we are reacting to what is happening around the country and the collective awakening of the members of our community who may not have seen the things that we see and the injustices that we see on a regular basis. So while, there is this, this concept that let's not overreact or let's not react, I feel we should react. I think we have a responsibility to react when we see the awakening of our nation because of an injustice that was seen, and we have a very deep understanding of what is happening, and we have a responsibility to show up in any and every space, whether it's individually or, collaboratively. We have to make our voices heard. That being said, what that means to me as an individual is going to mean something entirely different to somebody else on this panel potentially. And so we also have to have conversations with community, where if I represent a population of people, we have to have conversation about what's important to the members of my community. And that is something that's been missing. We've always talked about, community policing or whatever the case may be. But what does it mean when we're in actual collaboration with community on a consistent basis to understand and examine what they're going through and how that manifests in our advocacy? Many elected officials are not activists and are not organizers. But I think the time has come now where we can't afford to only be one thing. I can't just be a prosecutor. I have to fully commit to being a public servant, which means if I become an organizer, an activist, if I start advocating for food and for food security, if I start advocating against homelessness and for policies to be, put in place for advocacy for those who have mental health concerns, so be it, because that's what I have to do to make sure that I remove the harm from the system. And so, I just feel we can't limit ourselves. There is no one right answer because there's so much to correct, and it's literally going to take everybody from all different professions to commit to doing this work and getting it right for us to see a change. And again, I can't stress enough, we need transformative change. This ideology that we accept incremental change and it's going to take us 6 years and then we'll be able to see what the data says. We can't do that because people are dying, and we cannot just rely on the things that we tried before, like sensitivity training and anti-bias training and de-escalation. That's not removing the people who are racist. You can't train the racism out of somebody who is a system actor. And further, we've seen when we have, Dylan Roof, who is alive, and the person who did the Aurora Theater shooting who's alive, but then I have the victim in my city who was killed by an officer who was unarmed, who was killed. we know that there's an ability to de-escalate with some and the inability or the undesire to de-escalate with others. So we have to stop being cute. We have to have real conversations. We have to have them at every level as often as we can. And we just now have to flat out organize and activate in order to save lives. To me, it's that simple, that we just have to do it like Nike, just do it. We have to just do it.
If I can add about the legislature, I think most legislation, good or bad, some for passing of laws, or even in many states, they pass things like the Police Officer Bill of Rights, are usually done when the legislators believe that there's a threat or something counterproductive to the community. So earlier on, I talked about if we're going to reimagine public safety, then we need to engage all stakeholders, including legislatures, so that when you design the plan, when the community has said, I want public safety to look like this, then there's measures that the city can do. There's measures that the police need to do. There's measures that the prosecutors have to do, the county, the health system, and there's measures that the legislator may do. It may be write new laws that close gaps that should not exist, or repeal laws that have inadvertently or intentionally undermined accountability. And I think all of that has to be linked so that if the community is going to reimagine public safety and reimagine how it's going to look, it can't do that in isolation and then have to try to fight against laws that are passed that can do that, because the system is going to, here's what I think, and I'm not going to put any words into C.A. Morales' mouth, but the system is going to fight back. It's going to fight back hard, and it's going to seek legislative remedies to stop reimagining, to stop defunding. So we need to bring those stakeholders in there so that they can know that the community's behind them, the same community that votes for them, to know that this is what the community wants. The legislation we are asking you to sponsor is going to help that movement and not get a false narrative of fear and racism and hate. And before you know it, you create a whole bunch of measures that do nothing less than undermine the effort. So I think if we want to engage them, it has to be early, and we have to convince legislators and councils that this is in the best interest in the community, which goes to what Dr. Balfour and I were saying about this has to be community-led, not just community-involved, because the community-led has a lot more power because of their ability to vote. The community-involved, which still puts me as the system operator in control.
That's awesome. So I want to selfishly just keep this conversation going on with me, but we have a bunch of folks that have actually been listening in. So I'm going to turn things over to Terrence so we can get some questions from other folks.
Thank you so much, Brendan, and thank you to all of our panelists for your candor and your vision. It's really been a very interesting panel. So one question that was posed early in the chat, and I think that this is a good one possibly for Chief Davis. Are the law and order proponents of the Second Amendment sanctuary and constitutional sheriff's movements compounding the problems? And if so, is there anything that we can do to avoid that problem?
I would say the law and order philosophy is what got us contributed to a lot of the problems that we have right now. And the law and order, to be very candid, that philosophy is very dangerous, because if I were to translate it in terms as a Black male, a father of Black children, it is the mass incarceration of young men and women of color. It is the false narrative that the more you take people to jail, the more somehow the community will be safe. And this idea that we need to do this for your own benefit. I think more than law and order, which has been hijacked and now has a negative meaning, and we'll see this during the campaign, is we're looking for is peace and justice. That you want to create a community that has peace, but is justice, so that it's equitable for everyone in the community. So the idea about the Second Amendment thing, I'll avoid that debate, because here's the thing, if I'm going to be an advocate for the Fourth Amendment to protect my community, an advocate of the 14th Amendment for equal protection and due process, then I respect the Second Amendment rights, but like everything else, it still should have some safeguards and there's safety measures that we need to take, and that also should be part of reimagining public safety, what laws we are going to pass or not pass. But I would say, when I hear the word law and order, it tells me that, and I hear this from this administration, I will be a little political today, when I hear the Attorney General of the United States talk about law and order and wants to go back to the 90s, well, one, he has amnesia. Two, the 90s was the highest violent crime rate that we had. 3, we put millions of people in jail and didn't have any impact other than destroying complete generations of communities of color. And so to want to go back there when all evidence said that we failed, the war on drugs was a colossal failure and was harmful to the community, then why would anybody want to repeat those mistakes? And it means what you're trying to repeat is not the public safety aspect, it's the control aspect. And I think someone said this, Stephanie, I think it was you, goes back to why the system was designed. The system is not broke, it's doing what was intended to do. And some people want to keep that system in place because there's a lot of benefit to it. So I really think the law and order one, we as a community need to reject it every time we hear it.
Thank you so much, Chief Davis. Another audience member asked an interesting question about how to work with their local law enforcement. This attendee said that they are in a community where the sheriff threatened to withhold services from the public library when it wanted to issue a statement denouncing violence and wanted to support Black Lives Matter. How can community members work effectively with sheriffs and other law enforcement if they are of different political persuasions, or if the law enforcement in their community tends to be far more conservative than some of the members of the community? Any suggestions?
I have a suggestion, and I know I'm not, I will defer shortly to the resident sheriffs and law enforcement, but I have to say this, if there is any elected official, public official, or anybody else who's in a public service position who at this point cannot feel, first of all, feel, and then profess that Black Lives Matter, I feel you're unfit to serve, and so when you're dealing with somebody who, quite frankly, doesn't value the lives of a subset of the population of its constituency, I don't know what you can do to relate to that person other than to get them out. And so, that's really unfortunate if services are going to be withheld because you want to speak to the value of the lives of a certain member of your community. So I will defer to those who are in, the sheriffs on the panel and the chiefs on the panel. But I just have to say, that's incredibly unfortunate, because when you have a public official, an elected official making a statement like that or being retaliatory because, a member of the community and another servant wants to uplift, that's devastating. That's devastating to community. And how can we ask for community to acquiesce to any of that type of behavior and do anything other than try to eradicate that type of behavior from, the public sector and those who serve. So how you collaborate with that, I can't speak to, but we do have a responsibility to acknowledge when it's time to get people out of office.
So I think County Attorney makes some really good points. I don't know the situation about which was being referred. I don't know where it was. I don't know the sheriff. I don't know the politics of that area. We do have elections. We are term limited by election. I don't understand. I couldn't condone the action, so it's very difficult for me to suggest what we should do, except for the fact that we should continue to contact our elected leaders to let them know where we stand. I think that sometimes elected leaders are living in an old district. They're not living in the district as it has evolved. And they're not understanding that the district has evolved around them and why. And I think many times that can be, aside from just elections, but actually speaking with individuals and exploring a relationship in some ways. I mean, a lot of times relationships can bring you to new places. I don't want to speak about that specific case. I'm not speaking about that one, but the other question, I just want to mention one other thing. Some of the things that you could do to advocate, things like Medicaid. There are laws that were passed at a time when they seemed to be working right. Our incarceration laws of the 80s and 90s. Everyone thought it was the right thing to do. We now realize it wasn't the right thing to do. Getting rid, starting the Medicaid inmate exclusion, so those that are pretrial and sentenced don't have access to Medicaid coverage. And so we can make it easier to transition for a continuity of care, but otherwise it makes it much more difficult. Dumb idea, right? Probably thought it was being punitive. The idea that I'm trying to think of the loans. I spoke on Capitol Hill about the college loans. What was the name of it? The Pell Grants? That now those that are incarcerated couldn't have access to, that show it's a very small portion of our budget, lower recidivism, removed at a time when people thought they were being tough on crime. These are things that are being missed in some of the larger discussion that we should all be addressing as well. And once you kind of bring these issues to others with the data and the evidence to show that they can work, you can change those minds. So in some cases, people live in a district they used to live in, not the present district. And if that's the case, then the present district has to step up and do something about it as well, as the CA said.
And I'd just like to piggyback on that. As someone, I'm in a red state now. I was in Texas before this, so I've done, I've learned to speak red state. And especially around the mental health issue, which is where I'm most familiar with, is one of the areas where you can actually get agreement across party lines. And the way to do that is, different things speak to different people. So, what speaks to red state folks is responsible stewardship of taxpayer funds. And, sometimes people say I talk about like funding and cost savings too much, but my philosophy is you have to make the case for that so that people will fund it, so people can actually get the services that you want. And, a lot of this stuff makes good fiscal sense. And so sometimes, I'm not speaking to the specific case, but sometimes when you're, dealing with folks across the aisle, you make the argument that speaks to them, and that's one that people can agree on.
So unfortunately, we are very short on time, so I'm going to kick it back over to Chief Cox. Thank you for your moderating, and I think there may be enough time for a quick lightning round of final thoughts if anybody has any to share. So thank you all, and thank you to the Pretrial Justice Institute for hosting us, law enforcement leaders, on your platform today, and for your amazing technical assistance.
Thanks, Taryn. Very much appreciated. It was great being here. This has been a great panel. I want to thank the panelists. You guys were awesome, and I want to give you guys each, we have 3 minutes, so I want to give you guys each a chance to just give a quick closing, as I think you guys should close it out. So thank you very much. I'm going to go from where I see on my screen. So Dr. Balfour, you can go first. You are on mute.
Thanks for having me. And I actually learned a lot myself during this panel. And so, I guess in closing, it's that this is a community response. It's not about defunding so much as it is about, I think that's a simplistic term for a very complicated thing that maybe we get caught up in exactly what does defunding mean. I think, where we need to go is what does a healthy community look like, and how do all the different parts work together to achieve that? And the healthcare system, we need to step up and be part of that.
Thanks, Doctor. I appreciate that. Sheriff?
So I'll close with a line that I put out whenever I speak in public to almost any group. They could be young people or older people, not kids, but younger people or older people, or wealthy people or less wealthy people. It doesn't matter. I go to these groups all the time and I say, how many people know someone that has had a mental health issue? Raise your hand. And 2/3 to 3/4 to 90% raise their hand. They say, how many people know someone that has had a substance use disorder? Again, 2/3 at the very least to 3/4 to 90% raise their hand. And then I ask, how many people know someone's been incarcerated? It's always at least 2/3 that know someone's been incarcerated. My point is that these are not those people. There are people, there are neighbors, there are family, there are friends, there are people that we know and we have experience with. And I think, as Dr. Balfour said, when you connect on that level and you say, these are not those people. By the way, Texas has done some amazing things on mental health and incarceration issues, but that's because they found that meeting of what we would believe in, and also the fact that it brings benefits to tax dollars. I think you can always find those wins, and then you can reach across that aisle in a way that we really should be doing more anyway. But just as a closing, these people are not those people. They're our people. They're our family. They're our friends. They're our neighbors. They're our neighbors' children, right? They're our own children, and we can't forget that. If we remember that, then as a community, we can all get better outcomes.
Thanks, Sheriff. CM Morales?
I think we got about 10 seconds left, so I just want to say, I send my love to everybody, and I think that, as soon as we can all begin to see ourselves and see ourselves in each other, and truly love each other as we love our family members, we'll begin to do better by each other. And so I truly and sincerely hope that this conversation will be a catalyst for change and advocacy for everyone. And I truly thank you guys and everybody who is engaged with this discussion, because we have so much work to do, and it's a matter of life or death.
Thank you. Chief Davis, you got last word.
Oh, thank you. And thank you guys for hosting this today's panel discussion. Let me just say this, is I think after 35 years involved in law enforcement, either as an officer, chief, working for the feds, I am more optimistic today than I have been in my past 35 years, because I think this is one of the most unique moments since in 35 years that I've seen, in which the amount of change people want is not going away. It's sustainable. This is not a moment, this is a movement. I would say this though, as you proceed forward, and think about the Mandela phrase, only the truth can put the past to rest. Everything has to start with people sitting down and acknowledging the truth of our history, truth of the harm, and the truth to understand why we need to make the changes that have to be done. Then we need to be bold, courageous, and competent in doing so. And so I wish everyone well with doing that. I think hopefully I have also, like the doctor said, I've learned a lot today. Hopefully we can build off each other. And this is going to be a work in progress. It is not going to be perfect, but we still need to do it anyway because our communities demand it. So thank you guys for your leadership, and everyone have a safe evening.
Thanks all. Great conversation. Thanks everybody. Appreciate it. Enjoy the rest of your day. Be safe.